My name is Dr. Kareem Dawood. I'm one of the Foundation Year 2 doctors currently working at Pennine Acute Hospital Trust. This is a short talk to offer some useful information about itching in pregnancy. In this talk, I will explain what itching in pregnancy is, why do you get it, how does your doctor diagnose it, and what is the treatment for it. Itching in pregnancy is also known as pruritus gravidarum. Pruritus is the medical term for itchy or itching, and gravid just means pregnancy. Itching in pregnancy is actually really common and can affect up to a quarter of pregnant women. In some cases, however, itching can become extremely severe and tends to occur quite late in pregnancy. This condition is called obstetric choleostasis and requires medical attention. We will talk more about this a bit later on in the video. Pregnancy is a normal condition which changes the way your body functions when it's not pregnant. There are lots of changes that your body undergoes gradually as it accommodates for the growing baby, which include changes to your heart, lungs, body organs, skin and liver, which we will discuss in a bit more detail. A big part of the reason pregnant women itch is because it increases the amount of blood in your body. This stretches your skin, which is why you can normally feel the itch over your tummy and sometimes the entire body. The liver is responsible for lots of different complex body processes and is the main area where your body detoxifies or cleans up the blood. The liver also produces a substance called bile, which is used to help digestion. Next to the liver sits a small organ known as the gallbladder. Its main role is to store the bile produced by the liver and only release it when you eat to help digestion. It is released by the gallbladder along a small network of tunnels where it enters the duodenum, which is part of the small intestine, and mixes with the food and helps digestion. Once bile is no longer needed, then the liver's job will be to help get rid of bile. The itching is a result of an inability in the liver to process and get rid of the chemical salt known as bile salt, which, when it builds up, sits underneath the skin and makes you itch. In pregnancy, and especially in the last 3 months of pregnancy, which doctors and midwives often refer to as the third trimester, the liver can become seriously affected, which makes the itching extremely severe. You may appear yellow in colour and feel unwell, which can cause a condition known as obstetric choleostasis, or OC for short, something we mentioned earlier. OC is diagnosed using blood tests that look at both how well your liver is working, known as liver function tests, and the levels of bile in your blood. These blood tests will usually be repeated between every 1 to 2 weeks and again after pregnancy. Your doctor will also ask you questions about your medical history to see if you are at a higher risk of developing OC and to help rule out any other causes before diagnosing you with OC. There are certain medications that your doctor can give you to help reduce the itch when it becomes severe. It is important to be aware that OC can affect the health of your baby, which is why it's crucial to see a doctor if you are in doubt, and then make sure you attend for regular checkups and blood tests. If you are feeling bothered by the itch, there are a few simple measures you can do at home to help get rid of that itchy feeling. Some simple tips include: wear loose cotton clothing to help reduce the urge to itch. Avoid hot and steamy showers or baths, which can make the itch worse. Aim to use lightweight covers in bed so you don't overheat. Keep your skin moist using over-the-counter creams and moisturizers. Trial the use of over-the-counter oral antihistamine tablets.